Hello, I'm Noam Tiroler, and as you may already know, we are filming now a video course based on my book, Thai Acupressure. This video course will include all the 60 treatment protocols that are in the book. Welcome to our studio. Please meet Shiran. Shiran is a Thai massage instructor and will be my model in this program. Please also meet Kedan Etmo, our photographer and editor, and Andrea, that is assisting us with the camera. Andrea is also a Thai massage instructor. We're using 4 cameras in order for you to be able to see each point from different angles to make it as three-dimensional and as clear as possible. Most of the filming parts of the project is behind us, and we are left now with many hours of editing, and we hope very much to be ready on time. We will shortly share with you the first treatment protocol that we have edited. There are 59 more protocols in the final program. We will teach you a common condition that you probably all know of pain here at the outer side of the elbow that's called tennis elbow. You do not have to be a practitioner of Thai massage. Anyone using his or her hands to treat people can use the lines and points formulas of traditional Thai medicine. This video course is made for certified practitioners of any method of bodywork. Physiotherapists, osteopaths, and practitioners of shiatsu, tuina, deep tissue, Swedish holistic massage can all use these very effective lines and points combinations for the benefit of their client. You do not have to work on a mat, on a floor. Use a massage bed and use a chair for the sitting position. We usually treat our clients when they are fully dressed. We learn to locate the lines and points through touch. In this program, I will work on the skin so that you can better understand the locations of the lines and points. General Thai massage is well known now all over the world, but not many out of Thailand know of the medical knowledge of ready-made lines and points formulas for the treatment of the most common orthopedic disorders. That is only a part of traditional Thai massage. This knowledge is the heart of traditional Thai physiotherapy. Did you know that these treatment protocols are offered in special clinics in most of Thailand's hospitals today? There are several schools of medical massage in Thailand that teach very similar treatment protocols. They use the same lines usually and more or less the same points for the same disorders. Our program will teach you the protocols of the school of Wat Po that are very similar to the protocols of other schools but contain many more points.
Shoulders isi lang yung kanin.เลิกแล้วคุก3 นิ้วSome you just compare what that.
When I breathe,
Wait, 10 years.
so I press these bones.
No, friend opposite.
And if I breathe, then
10 years.
yeah. Oh, hold on.
Sudah selesai dewasa. Betulnyaไม่เร็ว 4 finger on the second line. Press this one. You breathe. Strong. Good. Okay. Do it again and breathe.
Let's couple.
Clavícula.
Sebenarnya okay.
Slowly.
Yes.
Are you ready to begin? So, how to treat tennis elbow in the traditional Thai way. The 60 treatment routines of the Wat Pho collection treat most of the common conditions that we see in our clients. When a client comes to us with pain, we have to match for him or her one protocol that is relevant to their condition. At times, we have to use 2 or even 3 protocols in the same treatment session. When your client has come to you for a general Thai massage, but he or she has also a complaint about pain that you diagnose as tennis elbow. You can begin with a general treatment for the whole body, but make sure to have enough time to work the points and the lines of the tennis elbow protocol or any other protocol. If your client came to you because of his or her pain and your session time is limited, say 25 minutes, work the points of the protocol only. The points are the most effective part in each treatment protocol. Work all the points once or twice until the end of the session time. Using points only is also appropriate in very acute conditions. Acute conditions call for stillness. Absence of movement is often best for acute pain. Lines work and general massage techniques may create unnecessary movement and pain. When a client has come to you because of a specific pain that is not that acute and you've got enough time, follow the treatment steps that are explained under the treatment steps section that will usually tell you to work first the specific lines of that protocol, of the protocol to that problem, and then work the points. When your points work is complete, continue with whole body treatment as time allows. Integrating treatment protocol in a whole body treatment is the most effective way to treat an orthopedic disorder because it's very helpful for headaches, for example. If you also treat the feet and hands and abdomen, and it's helpful for lower back pain if you also treat the upper back, shoulder blades, neck, head and face. Working the feet and hip can be very helpful for neck pain, for example. One treatment session may be enough, but often more treatment sessions are needed. Very chronic conditions will often need many treatment sessions. Begin with point 1 and continue with the rest of the points. One round of points won't be enough. You will have to do a second round and perhaps a third and even a fourth round of points. Work as long as the point is hungry for pressure. In the beginning, the points will be very hungry for pressure, but after a while they will become satisfied. They will then become sensitive for even mild pressure. If you keep on working them, you will bruise the point. This is the time to end the protocol part of the session and continue with general treatment procedures. Please make sure not to overwork the point. Experienced practitioners know the exact location of a point. They can feel the point and be very precise. The technique is also correct, and so they are very effective in the pressure and do not need many rounds of point. They can give a point what it needs in a relatively short time. To find a point, touch and feel the area of the point, and let your thumb guide you to the exact spot. Look for the nicest to press spot in that area, a spot that is inviting. Speak with the point. Slowly press it deeper and run a dialogue with your client through the point. Arrange your body so that you can focus comfortably on the point. Reach to the deepest part of the point, to its heart, and stay there. Wait. Let the body that you are treating come now to your thumb. If you are not sure, ask your client if it's deep enough or too deep. Most clients will be able to give you a helpful feedback, but some will not. Stay in the point as long as you feel is needed. Some pain may be good, but too much pain is not good at all. please do not impose too much pain on your clients. Please respect their preferred level of pressure. Do not repeat treatment until after the client stops feeling pain from previous treatment. Our treatment, if it's deep, may create, especially for a sensitive client, different pains that come about as a result of the treatment. These pains are good if they disappear within a day or two and leave the client in a clearly better condition than his condition before the treatment. In the case of such pain, wait until they are over before you treat again. Follow my instructions, learn the diagnosis, the treatment steps, learn the warm-up procedure. Learn the line and point locations for tennis elbow and learn the pressure technique. Practice first with family members, friends and colleagues, and when you feel that you understand the lines and point locations and understand how to approach them, you can also treat your clients. When your client is telling you of pain here below the elbow or above the elbow or both below and above the elbow, that is probably tennis elbow. The pain aggravates in different actions of the elbow and wrist, especially wrist extension, and whenever these muscles work or contract, the pain can be very irritating, and when it gets really bad, it's even hard to grasp and hold things. In Thailand, they say that the pain is here, but the problem is on the shoulder blade. If you treat the elbow only, the results may be slow. But if you begin with the shoulder blade, you will see very fast results. Step 1. Begin with a general treatment for the upper back, shoulder blades and neck. You can use any technique that you are familiar with. To learn common Thai massage techniques for the area, navigate to the upper back, shoulder blades and neck warm-up techniques in this program. For step 2, work all the 3 lines of the outer arm, 1 or 2 times, maybe even 3 times. The index finger, middle finger and ring finger lines. Use any technique that you are familiar with. To learn their locations in details and to learn common Thai massage techniques to work these lines, navigate to the lines of the outer arm in this program. For step 3, work the points. Begin with point 1, then 2, then 3, till the last point. Use the amount of pressure that suits your client. Repeat a few more rounds of points as long as improvement occurs. Stop when the points become sensitive. For step 4, if time allows, treat other parts of your client's body, preferably the whole body. Treat your client daily until recovery. In chronic cases, treat twice a week. Let's go briefly over the point just to remind you of the general location and how to approach them. For detailed explanation as to the exact location, navigate to any of the points that you need. This is point number 1, point number 2, point number 3, point 4, point 5, point 6. This is point 7. This is point 8. This is point 9. This is point 10. And this is point A. Press the first point and then the second and all the points. Usually you will have to do a second round, sometimes even a third or a fourth or even 5 rounds of points. Work as long as your client is hungry for pressure, as long as the points want more pressure. But in a moment when the points are, in Thailand they say tired, when the point is tired, when the point does not need pressure any longer, do not press it any longer, because any further pressure will injure the point. Point 1. Press this way, straight elbows. Point 2 in the same way. straight elbows. For point 3, this is not the best angle, so move a little bit so that you can press the point really effectively this way. Make sure you're in the right angle. For point 4, 5, 6, you should again change your angle to press them effectively. Press them this way. 5. 6. Press them against the lateral edge of the shoulder blade. For point 7, you should again organize yourself, maybe work this way, or with the hand of your client on the mat, and press this way, or hand on the waist and okay. For point 8, again we have to change position. Press this way, don't forget to shift upwards. For extra point A, press this way. For point 9, simply down, and for point 10, press the muscle against the bone. Repeat this several times. And now, it's your turn. Begin with warm-up for the upper back, shoulder blades and neck. Continue with the lines of the outer arm, and then work the points. Explore and have fun. Let me first show you the 3 back lines and the scapular lines, where all the points for headaches and neck and shoulder pains are. So line 1 begins here at the base of the skull, right next to the spinous processes. In the lamina groove. Line 3, let's speak about line 3. Line 3 is the lateral border of the paraspinal muscles. And yeah, it's going here. All the way to the hip bone. And there's another branch from here going on top of the trapezius. So this is line 3. Line 2 is halfway between lines 1 and 2. It's on the muscle, on the paraspinal muscles, on the trapezius here, the highest, stiffest part of the muscle. It's going all the way down to the sacrum. So all the points work are on these muscles, on these lines, and on the scapular line. Scapular line begins here above the scapular spine. It's going this way and then around the upper angle of the shoulder blade and down along the medial border of the shoulder blade, around the lower tip of the shoulder blade. So the scapular line is going around the upper angle of the shoulder blade and then along the medial border of the shoulder blade, around the lower tip of the shoulder blade, and then up along the lateral border of the shoulder blade, all the way to the scapular spine. And then it continues below the scapular spine to the medial border of the shoulder blade, and then down, and then up again to scapula 17, which is here a very important point. Begin with thumb pressure on the top of the trapezius, from the neck out, all the way to the shoulder and back. You can already feel the more stiff points, the points that you will have to later press, give more attention. So repeat that for 1, 2, 3 times. Press down to the floor. You can also press anterior to the trapezius, this area above the clavicule that is more tender. Be careful not to press too strong. And turn your hands and press above the shoulder blades, above the scapular spine, all the way to the shoulder joint and back to the spine. And then work the 3 back lines. Begin with the first line right next to the spinous processes, in the laminar groove between the spine and the paraspinal muscles, all the way to a point where you can still support the trapezius. You can still support them from falling forward. So go down to this point and then back up. Pressure is forward and slightly inwards towards the spine. And then line 2 on the paraspinal muscles. Most of our points are on this line. You can do this to feel the muscles and press forward. Again, go as low as you can, as long as you can still support them. We don't want to push them. We want to support them. And then up. And work the third line, just lateral to the paraspinal muscles. And the pressure is not only forward but also slightly inwards towards the spine. And again, as low as it can go and still support them, and back up. You can repeat that 1 or 2 times and then work the medial border of the shoulder blade this way. Collect skin down. Your client will hardly feel this. Collect skin down, press in, and then pluck the muscles up. You work with the skin and pluck the muscles here. So down very gently, in, and this is the work. Up, down, up, down, up. Work the higher half of the shoulder blade, or higher 2/3, and work this area. Support with your other hand. This is a very good technique. Pluck. So that you have a long way to go up. A long way to go up. Up and down, up and down, up and down. And then to work this part, work in the opposite way. Switch hands. Switch hands. Use this thumb now to collect skin up. He hardly feels this. This is not the work yet. And then press and down along the medial border of the shoulder blade. Pluck the muscles down. You may be able to hear that. Collect skin up, press and down. Okay? Work the lower half or lower 2/3 of the shoulder blade. Repeat that a couple of times. You can repeat that many times if your client needs that. So work the medial border of the shoulder blade this way, and some clients will need a somewhat stronger pressure. So in this case, do the same as step 1, but use thumb on thumb. Collect skin down, press and up. Skin down, up. This is much stronger than this. And then use this thumb to work the upper angle of the shoulder blade. 1, 2, maybe 3. In the same way, collect skin down, press and pluck, 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 pluck. And now you can work the outer border of the shoulder blade. You have to move a little bit to the side of your client. And work perpendicular to the border of the shoulder blade. Collect skin anterior, press and pluck, pluck, pluck against the muscles that are on the lateral border of the shoulder blade. And then don't forget to work this angle. And you can switch hands and work along the ring line all the way to the elbow and back. Or you can also work the middle finger line in this way. And work the scapular line. You can work it systematically or work lines like this. 1, 2, 3, 2, 1. Go down a bit. Again, 1, 2, 3, 2, 1. And then another line. 1, 2, 1, 2. Okay? Next is to work the 3 necklines. The best is if, of course, you have to work both shoulder blades. Begin with thumb circles. Then line 1, push the muscle and the skin away from the spinous process. All the way down to C7 and up again to the base of the skull. Line 2, just press the muscle towards the center of the neck. Can repeat each line 2 times, and then line 3. Line 3 is somewhat more sensitive, or actually much more sensitive, so be careful, especially with elder clients. And you can also, of course, massage the base of the skull, and also this part. Switch sides, and again thumb circles, line 1, line 2, Line 3. So we work the neck, the shoulder blades, and the upper back. We do everything that is not stretch. We don't want stretches because stretches may be painful and may cause damage. Now the index starts here and goes down right below the edge of the acromion process and on the median middle head of the deltoid and over the humerus, over the bone, and here inside. Let me draw for you the lines on the forearm. Shiran, do this with your... Okay, so you can see this muscle. So the index finger is on the top of this muscle. Yep. Thank you. Finishing here in a depression that is in line with the index. It's not this point. It's not this point, but the anatomical snuff box that is between these two tendons, but rather here in this depression. And we have the middle finger line depression and the ring depression here. Index finger line. use the joint of your thumb Okay, to work the index finger, use the joint of your thumb, and do not work this way because you will slide sideways, but rather work this way. Use the power of your muscles. The line runs over the radius here, but then the radius is going this way. Index finger line starts here and climbing on the radius, and continuing on this muscle. Then continue over the humerus and reaches the acromion process. It's a good idea to come from here. One hand is holding the arm, controlling the arm, and the other thumb is pressing. And stop here. Stop at the elbow. You will do this part later on. It's not that comfortable to work it from here, so the best is to change position to work the arm. So we separate and work on the forearm separately. the middle finger line starts from here and travels down right behind the humerus. The middle finger line runs here and then here halfway between the radius and ulna, finishing at a depression here that is in line with the middle finger. Feel the bone, the humerus, and press the muscle, the skin, stretch it behind the humerus, behind the humerus. Okay? So, this is the middle finger line. Middle finger line starts here, climbs between the bones, and then in a depression between muscles. middle finger line begins here in the depression here, slightly radial to the center of the wrist, and climbing between the two bones, and then in a depression here, in a depression between two muscles. This line continues on the lateral posterior or posterior lateral aspect of the humerus, and in a depression for this line. You may use one hand as I do, or to apply more pressure, use both hands. Use the joint of your thumb. You can also, of course, use one hand, one thumb, and to roll this way, use your other hand to roll the other way. ring finger line begins here, going up to the axillary crease. On the median head of the triceps. Ring passes here and climb over this muscle. This is the head of the humerus, so it comes here and then goes down along this muscle, radial to the head of the ulna, okay, and stops here. You can press from the ulna, push the muscle medially, push it away from the bone. You can use both thumbs to press the muscle. ring finger line begins here in a depression and climbs radial to the head of the ulna and all the way to the head of the radius that is here. It then continues behind the elbow on the median head of the triceps all the way to the axillary crease. You can work this way using one hand. Stop here because it's really almost impossible to work the arm part of this line. You can pluck the muscle or use both thumbs. And for this line, the ring finger line and middle finger line come from this direction. For middle finger, turn this way. For ring finger, the other way. Ring, middle. Middle finger, ring. Scapular 14 is here. To find this point, slide your finger below the scapular spine all the way until you stop at the medial border of the shoulder blade. It's the lateral edge of the medial border of the shoulder blade. This is the medial edge, this is the medial border, this is the lateral border of this bony spine or prominence. And the point is trapped here in this angle. It's very easy to find this point. Usually, this point usually radiates sensation to the front of the shoulder. To press this point, support the shoulder and press. Press scapular 14, move a bit to the side, press from this angle toward the chest, toward the center of the body. Scapular 14 is right below the scapular spine and right lateral to the medial edge of the shoulder blade. This point is trapped in this angle, so you cannot go medial or upwards. Scapula 15 is halfway between this angle, this bony angle formed by the scapular spine and the medial border of the shoulder blade, and another bony angle that is formed by the medial border of the shoulder blade and the lateral border of the shoulder blade. So you can feel a V-like, a V-shaped angle here. This is scapula 16, and scapula 15 is halfway between. Try to find a stiff, small muscle here. And this point also radiates sensation to the front of the shoulder, very often, not always. Press scapula 15 from here. Support the shoulder and press towards the chest, the sternum. Use open hand. Support the other shoulder. Scapula 15 is 2 fingers below the scapular spine, right lateral to the medial border of the shoulder blade. It's 1 finger below scapula 14. Find a nice muscle here. Press either with 1 thumb or both thumbs. Scapula 17 is a big muscular point here, usually stiff, very important point for shoulder pain and also sometimes for neck pains that is radiating down the arm. To find this point, different ways to find this point. It's actually halfway from the upper angle of the shoulder blade point and the axillary crease. So halfway here, or from this point, from scapula 14 that is trapped in the angle here, it's 1 finger towards the axillary crease. Jump and you will find a point. It's also, if this is the shoulder blade, it's on a line that runs in the center of the shoulder blade, and 1/3 of the way from the scapular spine to the lower tip of the shoulder blade. Okay, so 1/3 of the way on this line, which is here. It is also halfway from scapula 13 to scapula 14 and 1 finger below the scapular spine. So jump, and here is the point. It's a big point. Work scapula 17, come from the side. Find this big, stiff point and press towards the center of the body. Very strong point. Support the shoulder and look for a nice muscle here in the middle of the shoulder blade, the upper third of the shoulder blade. It's 1 finger from scapula 14 in the direction of the axillary crease. Find a nice big stiff point here. You can view it as a big point. Press using both thumbs. This point radiates sensations in all directions. Scapula 12 is halfway from the axillary crease to the scapular spine. It's here. Usually 2 fingers above the axillary crease on the lateral edge of the shoulder blade. Press this point this way. Press it from the side and look for a muscle, stiff muscle here. Yeah, this is the teres minor. It's a very strong point. Press against the lateral edge of the shoulder blade. Scapula 12 is 1 or 2 fingers above the axillary crease, or halfway from the axillary crease to the scapular spine, halfway, and then find a point on the lateral edge of the shoulder blade. A stiff, nice muscle, very sensitive spot here. To press this point, pull the shoulder over your client a little bit so that you can press down towards the center of the body. You can use both thumbs. Scapula 11 is level with the axillary crease. On the lateral edge, lateral border of the shoulder blade. So level with the axillary crease. To press this point, come from the side of your client, this way or better, this way. Move a bit to the side, support the shoulder of your client, and move from the axillary crease towards the shoulder blade, same level, and press. Press in this direction. Scapula 11 is on the lateral edge of the shoulder blade, level with the axillary crease. So, here. press using one thumb or both thumbs. Press towards the center of the body of your client. Make sure to work with straight elbows and be really high. This point is halfway from the lower tip of the shoulder blade to the axillary crease, right lateral to the lateral border of the shoulder blade. To press this point, you should come from the side of your client, support his shoulder, and press perpendicular to the lateral border of the shoulder blade. To do scapula 10, it's better to move a bit to the side and face the side of your client. Support his shoulder and press this way, this angle, perpendicular to the lateral edge of the shoulder blade. Scapula 10 is halfway between the axillary crease and the lower tip of the shoulder blade. It's on the lateral edge of the shoulder blade. Press using one thumb or both thumbs and press onto the lateral edge of the shoulder blade. This point is here. The point is here just above the oleocrenon, in the depression here of the common tendon of the triceps. This point needs much pressure. You should find your way to press this point deep enough. One way is to work using the power of your hands, and you can also lean a bit onto the thigh of your client, this way. Press into the depression. To press ring finger 4, you can ask your client to put his hand this way. Either press using one thumb or press thumb over thumb. You can work this point this way. Support with one hand and press. Or switch hands, catch the forearm with this hand and press. Here in the depression, right above the oleocrenon, on the common tendon of the triceps. It's a nice depression that you can locate easily. Press down towards his hand. Right above the oleocrenon, in the depression here over the common tendon of the triceps. You can press this point this way. This way. This point is here. It is 1 or 2 fingers above the elbow. The best way to find this point is to slide with your finger over these muscles, and then you fall down to the bone, to the humerus. This is very strong, very tender point, very effective point. This point is said to control the arm. We use it for many wrist problems, elbow problems, arm problems. Place your thumbs, push the skin up and press. You don't have to press that hard, that strong. This point radiates sensation down to the hand. Slide your finger and push up and in. Use thumb over thumb. Two fingers above the elbow. The best way to find the point is to slide with your thumb over these muscles and land here. So the point is here. It's on the humerus, slightly medial to the humerus. Press a little bit, shift upwards, push upwards, and then press a little bit more. This is very strong, that controls the arm, sends sensations down to the hand. This point is here, just medial or radial to the lateral epicondyle of the elbow. Feel the bone here and press right medial to this bone. It's also level with the elbow. When you bend the elbow, it's the end of this crease here, exactly here. Press this way. Support with your other hand and press in. Or press this way. This point is at the end of this crease here in the depression here. press towards the center of the elbow. You can press it also this way. This point is here. It is 2 fingers below the elbow. It's a very useful point for different arm, elbow, wrist problems. So 2 fingers. This point is a depression between heads of 2 different muscles. It's easy to find this point. It's a very strong, effective point. Best way to work this point is to use thumb over thumb this way. Sometimes to apply a lot of pressure, long pressure, you will need to use your elbow. Middle finger line 3 is 2 fingers below the elbow in a depression between 2 muscles. Press this way. Hold the forearm. This point is here. right below the head of the radius. The radius is going this way and this is the head of the radius. So just below the head of the radius you can feel a muscle here, and you should press over this muscle and onto the bone. Use the joint of your thumb. Find this muscle here just below the head of the radius. Feel it with the joint of your thumb and press. It's right below the head of the radius. Find the tendons here and press down. You can use both thumbs so that the muscle does not slip sideways, or use one thumb only.